Good morning, everyone, and welcome to today's webinar titled Strengthening Molecular Diagnostic Solutions in Africa with Lasec and Bioeksen. My name is Alana Tehran, and I am a biotechnology application specialist at Lasec, and it is my pleasure to be your host for today's session. And I would like to thank all of you for taking the time to join us. During today's webinar, we will explore how Bioeksen's technologies support reliable molecular testing, an essential component of effective diagnostics, disease surveillance, and research across Africa. We will discuss key considerations for achieving optimal qPCR performance, and in addition, we will highlight how Bioeksen's unique value proposition and competitive advantages compared with other molecular diagnostic solutions currently available on the market. To ensure this session is as relevant and as interactive as possible, we will conclude with a live Q&A session where we can address your laboratory-specific needs. Please feel free to submit your questions in the chat throughout the presentation. Before we begin, I am delighted to introduce our speaker, Mustafa Karakas. Mustafa joined Bioeksen Technologies in 2023 and currently serves as a sales and strategy executive overseeing both international and Turkish markets. In his role, he works closely with laboratories and partners worldwide to expand access to innovative molecular diagnostic solutions. In today's presentation, Mustafa will share Bioeksen's vision of making molecular diagnostics more accessible, practical, and efficient for laboratories around the world, while showcasing the technologies and solutions that support this mission. Without further ado, I will hand over to you, Mustafa.
Thank you, Alana. Thank you all for attending this webinar. It's such a pleasure to have the time to meet you and see you all. Hopefully, it will be a beneficial presentation for all. So, as Bioeksen is founded in 2014 by immersed scientists. Bioeksen was born at Istanbul University Technopark with a clear mission to advance molecular diagnostics. Unlike many companies, we have grown without external investors, relying instead on research grants to develop hundreds of diagnostic solutions across human health, animal health, and food safety. During the pandemic, we distributed over 200 million PCR tests to 72 countries, earning both FDA emergency authorization and a place on the WHO emergency use listing. In 2021 and 2022, Bioeksen has been Turkey's leading medical device exporter. In 2023, we launched our molecular wastewater surveillance panels. In 2025, we introduced our fully automated sample result instrument SimoLab. And in 2026, we achieved IVDR compliance with hard printed certificate on its way to our headquarters. I present to you the SimoLab instrument, Bioeksen's next generation molecular diagnostic platform. It is designed to bring full automation, high speed, and high capacity to our laboratory in all-in-one compact benchtop instrument. SimoLab delivers full automation from cap primary sample tube all the way to LIS reporting. No manual intervention is needed. It is fast, results in just 70 to 90 minutes. It is also high capacity, processing up to 1,500 samples per day. Unlike many SAC systems, it does not require sample batching. You can load any number of samples at any time with no consumable waste. The instrument is compact. It is just 1 meter wide and highly flexible, supporting multiple assays and sample types. SimoLab supports a broad portfolio of 35 CE IVD multiplex panels, covering a wide range of infection diseases such as respiratory infections, gastrointestinal infections, human papillomavirus, sexually transmitted infections, urinary tract infections, and so on. Here we'll just watch a workflow and introducing SimoLab. First, the user will load the sample tubes into the instrument. Then the instrument will initiate by reading the barcodes, decapping automatically, and pipette the samples into the extraction unit. As soon as the extraction unit is completed, now the system will pipette the samples into the IV automation device. Then our sigmoid software will automatically interpret and evaluate the results. Currently, sample result instruments fall into four main categories, depending on their capacity and speed. Fast high capacity, slow mid capacity, slow high capacity, or fast and low capacity. SimoLab combines the best of all four. Since sample batching is not required, you can run samples as they arrive. No need to wait for a full batch. You can also load new samples every 30 minutes, enabling continuous loading throughout the day. In terms of waste, only 1x plastic waste is generated per sample, while competitors generate up to 5x. And with the daily throughput of 1,520 samples, SimoLab delivers up to 7x more capacity than some alternative systems. Competitors are either slow, low capacity, or generate excessive waste and manual steps. SimoLab solves all of these challenges in one integrated platform. In summary, SimoLab is designed to increase your lab efficiency, reduce costs, and simplify workflows. This table shows a balance that no other instrument on the market can offer. Bioeksen's technology combines speed, user-friendliness, and cost efficiency, making reliable molecular diagnostics available to everyone. Our system offers clear advantages over competitors. Our qPCR system requires just one step. Load the sample and the system handles the rest, including automated reporting. Conventional systems require 9 steps, and even lyophilized systems require minimum 5 steps. For swab samples, thanks to our VNAT transfer tube, without the nucleic acid extraction phase, we can deliver results in only 50 minutes, making us 3 times faster than conventional systems. For larger panels, we are the fastest option available. For other sample types, our modular automation performs robotic extraction in only 90 minutes and qPCR in 50 minutes, matching point-of-care speed while being 3 times faster than traditional competitors. In this workflow, we will expand more on how the process is completed. First, the user will pipette the sample, a swab sample, which will locate into the VNAT transfer tube, into the VCAP tubes. And in only one step, the PCR set is completed, including the extraction and the PCR setup. The MIC instrument will initiate, and only in 50 minutes, the results are available. Bioeksen offers 2 qPCR consumable formats in addition to the VCAP format, lyophilized format and liquid format. In the lyophilized format, consumables are designed for single-use applications. The format includes pre-aliquoted qPCR strips and enzyme mix tubes. The user first transfers the sample into the enzyme mix tube and into the qPCR tubes. This format simplifies the process by using pre-prepared regions, reducing hands-on time and minimizing the risk of error, making it faster and easier to use for each experiment. For laboratories that require flexibility to work with various qPCR instruments, Bioeksen provides a liquid format. This format includes an enzyme mix tube and an oligo mix tube. Both tubes contain the necessary regions in bulk. The liquid format follows the standard manual PCR setup, offering full control over reaction preparation, ideal for labs with established protocols and multiple instrument types. Both formats are valid and compatible with a wide range of qPCR instruments, making Bioeksen's qPCR consumables versatile and suitable for various laboratory setups and user preferences. Respiratory tract infections are among the most common reasons for hospital visits worldwide. They can be caused by a wide range of viral and bacterial pathogens, often in combination. Early and accurate detection of these pathogens is critical, especially because viral co-infections can damage epithelial barriers, increase bacterial invasiveness, and lead to more severe disease. Bioeksen respiratory panels are valid for a broad range of sample types, including throat swabs, nasopharyngeal swabs, saliva, sputum, and bronchoalveolar lavage, allowing laboratories the flexibility to work with the sample types they routinely collect. We offer respiratory panels, each designed for different needs. The respiratory tract infection panel is our most comprehensive panel, covering 20 viruses and 7 bacteria, including SARS-CoV-2, influenza A, B, and respiratory syncytial virus, and key bacterial pathogens like Streptococcus pneumoniae and Mycoplasma pneumonia. It's designed for laboratories that need full coverage in a single test. Our respiratory ID toolkit detects 6 key respiratory viruses responsible for over 80% of infections, plus Streptococcus pyogenes. It's a highly economical solution compared to standard flu A/B, SARS-CoV-2, and RSV kits, with 3 additional pathogens at no extra cost. Viral co-infections are associated with more than 50 increased risk of invasive gas infections, which have a reported mortality rate of 20 to 40%. The respiratory ID2 panel offers broader coverage, including multiple coronaviruses, parainfluenza types, and bacterial pathogens. It's a cost-effective syndromic solution for laboratories that want a balance between coverage and cost. The respiratory tract virus panel focuses exclusively on viral respiratory pathogens, covering 14 key viruses. It's ideal for laboratories that want a comprehensive yet cost-effective viral testing solution. We offer several additional respiratory panels, each shared with different testing needs. The respiratory tract 40 PCR kit is a simple, fast solution for detecting the 4 most common respiratory viruses: SARS-CoV-2, influenza A, influenza B, and RSV-AB. It's ideal for laboratories that need a quick, cost-effective test for the most frequent laboratory accuracy targets. For laboratories that specifically need to detect group A Streptococcus, the cause of strep throat and related infections, the gas kit target kits offers a focused economic solution. The lower respiratory bacteria panel is designed specifically for lower respiratory tract infections. It covers a wide range of gram-positive and gram-negative bacteria, as well as atypical bacteria. It's an excellent tool for laboratories that need to differentiate between bacterial pathogens, pneumonia, and lower respiratory infections. Here we will look into an external control measurement established by QCMD. So for the given sample, the target pathogen was Streptococcus pneumonia. And in the table, you may see that Diagnostics was able to establish a 60% of success rate, while the rest 40% was given inconclusive results. QIAGEN gave 15% of wrong results, false results, and the rest is completely inconclusive results. CGen was only able to successfully give 60% correct results, and the rest are either false results or inconclusive. In comparison, Bioeksen was successful to give 100% successful correct results. Tuberculosis. Traditional tuberculosis culture takes weeks and possesses biosafety risks. Real-time PCR gives results in hours, enabling faster diagnosis and treatment while eliminating the need to handle live bacteria. Understanding the resistance status of Mycobacterium tuberculosis to available antibiotics help clinicians tailor the treatment regimen for each patient. If resistance is detected, alternative drugs or combination therapies can be prescribed. Bioeksen adopts a stepwise approach to tuberculosis testing. Initially, samples are screened for the presence of Mycobacterium tuberculosis. Subsequently, first-line antibiotic resistance testing is conducted on positive results, followed by second-line antibiotic resistance testing for cases showing resistance to first-line antibiotics. This stepwise approach avoids unnecessary resistance testing on negative samples, saving both time and costs. Traditional urine culture has limitations. Normal flora can mask pathogens, antibiotics can cause false negatives, and results can take 24 to 48 hours. The Bioeksen UTI kit offers a faster, more accurate alternative. It is the only rapid molecular panel available for UTI testing. Unlike culture, which only tells if you have the pathogen present, our kit provides semi-quantitative detection, helping distinguish true infection from contamination by identifying the most abundant microorganisms. The Bioeksen STI kit tests the most prevalent viral, bacterial, and parasitic pathogens related to sexually transmitted infections in only 1 hour. This first turnaround time enables prompt diagnosis, which is crucial for initiating early treatment, preventing further transmission, and reducing the risk of complications. Many STIs can be caused by multiple pathogens or have overlapping clinical presentations. The Bioeksen STI kit allows for the simultaneous detection and differentiation of various pathogens in a single test, enabling comprehensive screening. The kit covers 13 targets, including 2 viruses, herpes simplex virus 1 and 2, 11 bacteria such as Streptococcus agalactiae, Gardenia vaginalis, Neisseria gonorrhea, among others, and make it effective for diverse pathogens. The Bioeksen STI kit can also be utilized with non-invasive sample collection methods, including urine or self-collected vaginal swabs. These methods offer convenience and increased accessibility and privacy for patients, resulting in improved compliance with testing. Human papillomavirus is the most common sexually transmitted infection worldwide. In 90% of the cases, the infection clears naturally within 2 years without causing health issues. However, persistent infection with high-risk HPV can lead to serious conditions, including cervical cancer and other HPV-related cancers. Among the 14 high-risk types, 16, 18, and 45 are the most commonly found HPVs in cervical cancer. Bioeksen offers a comprehensive range of HPV testing solutions to meet different clinical and laboratory needs. Our genotyping kit identifies and distributes all 14 high-risk HPV kits targets. Additionally, our low to medium risk genotyping kit detects the most prevalent low to medium risk types. Our genotyping kit detects and differentiates between both high risk and low to medium HPV types. Our high risk HPV screening kit detects all 14 high risk types, but only differentiates 16, 18, and 45, ideal for cost-effective screening. Lastly, HPV screening kit detects both high risk and low to medium risk types, distinguished between low and high risk for economical screening. Bioeksen is proud to support Uzbekistan in decentralizing HPV screening, making cervical cancer prevention more accessible than ever before. A total of 30 instruments have been deployed across 15 strategic locations nationwide, ensuring that HPV testing is available where it is needed most. This decentralized approach brings testing closer to patients, reducing the need for sample transport. This not only saves the time and shipping costs, but also significantly reduces the risk of sample degradation during transit. With fast on-site results, healthcare providers can make immediate clinical decisions and initiate follow-up without delay, improving patient outcomes and reducing loss to follow-up. This approach aligns with WHO recommendations, which promote self-sampling and local testing to improve access, equity, and cost-effectiveness in cervical cancer screening programs. With Bioeksen solutions, Uzbekistan is taking a measured step towards more accessible, efficient, and equitable HPV screening. Antigen tests are commonly used for gastrointestinal testing, but they have limitations. Both negative and positive results can be unreliable and often require confirmation by PCR. Real-time PCR offers superior sensitivity, especially for detecting low-level infections. It also reduces the false negative positives by detecting specific genetic sequences, avoiding the cross-reactivity and non-specific binding that can occur with antigen tests. PCR also provides quantitative information about pathogen load, which is valuable for monitoring dual infections and treatment response. Gastrointestinal infections can be caused by bacteria, viruses, parasites, or fungi. many with similar symptoms. Relying on symptoms alone is not reliable. PCR's high multiplex capacity outperforms immunoassays, saving both time and results. Bioeksen offers the most comprehensive solution, covering the most prevalent bacteria, viruses, parasites, and fungi associated with gastrointestinal infections. For more economical testing, we also offer viral, parasitic, or bacterial subpanels. In addition, Helicobacter pylori kit detects clarithromycin-resistant strains, a major cause of treatment failure. It is validated on stool samples, making a non-invasive, patient-friendly, and alternative to endoscopy or biopsy. Here, we will investigate another QCM result, where here the target pathogen was Gardia lamblia. Here, BD molecular diagnostic was able to successfully detect all 8 cases. CGene was able to only provide 25 to 30% success rate, while the rest is given false results. Bioeksen was able to give 90% success rate, while the remaining 19% was false results. While Bioeksen, again, was able to give a 100% reliable result with this testing. Central nervous system infections can often present with similar symptoms, making it essential to differentiate between viral, bacterial, and fungal causes. Bacteria's central nervous system panel uses qPCR technology to identify the most common pathogens, delivering results in under an hour compared to days or weeks with culture. Faster, reliable, and comprehensive, the Bioeksen's CNS panel supports timely informed treatment decisions and better patient outcomes. Bone and joint pathogens are often anaerobic or biofilm forming, making them difficult to culture and leading to false negatives or delays. Bioeksen's kit addresses this by rapidly testing for the most common bacteria and fungi in these infections, delivering results in only 50 minutes. This kit covers 27 targets, 26 bacteria, and Candida spp. Fast, reliable, and cost-effective. The bone and joint kit enables prompt, informed treatment decisions and improved patient outcomes. Bioeksen's Candida panel is a complementary tool used when Candida spp is detected in a sample. It identifies the most prevalent Candida species, including the emerging threat of Candida auris, enhancing diagnostic accuracy. This panel is validated for various clinical samples, targets 6 fungi, delivering efficient, high-capacity testing for better patient management. Sepsis is a life-threatening emergency. Without timely treatment, it can lead to organ failure and death. In fact, 1 in 3 hospital deaths are sepsis-related. Mortality increases by 10% for each hour of delay. Upon diagnosis, broad-spectrum antibiotics are given immediately. Within 8 hours, a second dose is administered. Rapid diagnosis enables the use of targeted, narrow-spectrum antibiotics during the second window, reducing resistance, protecting normal microbiota, and cutting costs. Traditional culture methods are slow, taking 48 hours to weeks, and often fail, especially in patients already on antibiotics. False negatives occur in over 50% of the cases. Bioeksen sepsis kit delivers results in just 1 hour, directly from whole blood. It detects the most common bacterial and fungal sepsis agents, plus resistance markers for vancomycin, methicillin, and beta-lactams. It avoids both false negatives and contamination issues. This kit covers 30 targets differentiating gram-positive, gram-negative bacteria, fungi, and resistance markers. Combining PCR with culture provides the most complete assessment for speed and reliability. Bioeksen sepsis kit is a crucial tool in the fight against sepsis. Testing for antibiotic resistance is essential. It guides therapy, detects emerging resistance, and prevents ineffective treatment. Bioeksen's APR kit provides direct testing for the most prevalent resistance markers for clinical samples. Results are available in just 50 minutes, enabling prompt targeted treatment. Bioeksen offers a comprehensive qPCR portfolio covering the most prevalent viral, bacterial, and parasitic pathogens associated with fever and rash, enabling rapid diagnosis, effective patient management, and strong disease surveillance. The fever-and-rash panel targets 21 pathogens, 11 viruses, 7 bacteria, and 3 parasites. A smaller panel is also available, focusing on 4 key viruses for more targeted testing. Bioeksen provides comprehensive qPCR testing for all major fever and rash-related pathogens, including viruses, bacteria, and parasites that can cause serious health complications if not diagnosed promptly, such as Fleming Congo hemophilic fever, West Nile fever, and Plasmodium. Thank you all for your time and attention today. I hope this session has given you a clear picture of Bioeksen solutions and how we can support your diagnostic needs. If you have any questions, we are more than happy to answer them.
Thank you, Mustafa, for the insightful presentation. I think it's always good to understand what other products there are in the market, especially for the qPCR realm. And I think particularly in our markets, IVD assays are hard to come by. So thank you so much for that. Thank you everyone for joining the webinar. We really do appreciate your time and participation and hope that the session provided valuable insights into Bioeksen's diagnostic solutions. Please, if you have any further questions or would like any additional information about the products, please feel free to reach out to the Lasec team, and of course, we will help you in the best way we can. Thank you once again, everyone, and enjoy the rest of your day.